Hello and welcome to Urgent Care on Call. My name is John Essen and I am a practicing emergency medicine physician, and by popular request I am here to discuss what we need to know about asthma and its prevention. As you may know, asthma is a chronic disease of the airway that transports the much needed oxygen to the lungs in exchange for carbon dioxide. However, what we need to keep in mind about asthma is that while no cure is available, compliance with medical management can help a person with asthma lead a full and productive lifestyle. So then, what exactly is asthma? In order to appreciate the impact of this disease, we need to talk about some numbers first. In the United States alone, roughly 8 to 10% of the general population have some form of asthma. And worldwide, around 250,000 people die every year as a result of asthma. So globally, as you can see, this is a big deal. The best way to understand this disease is to think of it as a reactive airway disease, one in which the inner walls of the airway, known as the bronchial tubes, become swollen and inflamed. This inflammatory response makes the airway super sensitive to irritants, thereby increasing their susceptibility to an allergic reaction. And this often results in swelling and narrowing of the inner walls of the airway. And also at the same time, the outer muscles of the airway constricts and tightens the airway, making it difficult for air to flow in and out of the lungs. As you can probably imagine, this type of reaction causes an overproduction of mucus in the already tight airway. Patients often present with symptoms or periodic attacks of chest discomfort such as shortness of breath, audible wheezing, grunting, and coughing that might begin abruptly and can range from mild to severe. However, in the severe form of asthma, this inflammatory reaction involving the airway can prevent oxygen from reaching the lungs, thereby preventing it from entering the bloodstream and starving vital organs from getting the much needed oxygen for survival. To say the least, this can become a life-threatening emergency, often requiring emergent attention and hospitalization. So the take-home message here is that people with clear symptoms of asthma should always err on seeking immediate medical attention or going straight to the emergency room for treatment. This might be the appropriate time to activate EMS or rescue if the symptoms are severe. A trip to the emergency room, though, is always the safest alternative for an asthmatic during an acute attack. This also provides the opportunity to discuss management techniques, identify potential triggers and how to avoid them, and also to get medication to help reduce the frequency of future attacks. Now that we have a better understanding of the dynamics of asthma, we can now talk about the different types of asthma. Based on our discussion so far, it is conceivable that many different factors are responsible for causing asthma. That said, it is also important to keep in mind that there are many different forms and stages of asthma, often separated by age and the severity of the disease. However, we all share the same triggers that stimulate an allergic response in an airway. And this often includes airborne pollutants, pollen, household pets, tobacco smoke, mold, upper respiratory infection, even gastroesophageal reflux disease or GERD, inhaling cold, dry air. And believe it or not, stress can also become a trigger for an asthma attack. So as you can see, the development of asthma can be both environmental and genetically predisposed. At best, it is fair to say that causes of asthma is multifactorial. However, that said, it is the most common chronic disease among children, and the earliest symptom of a reactive airway disease often manifests itself well before the age of 5 in the form of wheezing and regular respiratory infections. So now that we have a better idea of the pathophysiology of asthma, let's talk about the different types of asthma. We can start with childhood asthma. While some children with asthma may experience more regular and severe attacks, the common characteristics among them is that they often present with a heightened sensitivity to substances that cause allergy. A good example is secondhand smoke. This causes severe problems for children with asthma. To put this into perspective, according to the American Lung Association, between 500,000 and 1 million children experience worsening asthma symptoms as a result of secondhand smoke. I often get asked the question, will my child ever outgrow asthma? To be honest, there is no concrete answer to that question. However, though, it is believed that asthma might resolve without treatment during childhood. However, there is still a risk that their condition might return later on, especially if symptoms are moderate or severe. So let's move into adult onset asthma now that we've touched on the childhood asthma. The key here is that asthma in adults is often persistent and requires the daily management of flare-ups and preventing symptoms. Remember though, asthma can begin at any age, and allergies are responsible for roughly a third of the adult's presentation of asthma. On the other hand, one thing we rarely think about is that obesity is also a strong risk factor for adult onset of asthma. And within this group of adult onset asthmatics, women are more likely to develop the condition after the age of 20. Another interesting data regarding the mortality of asthma is that people over the age of 65 make up a large proportion of the deaths from asthma annually. Another interesting group, or type, is what is known as the occupational asthma. Some may find this hard to believe though. However, studies have shown that this is a real phenomenon. It is a type of asthma that occurs as a direct result of an occupational exposure, and there is a direct correlation with symptoms and attendance at particular industries. Industries such as manufacturing or even people that work in laboratories are commonly afflicted with occupational asthma. In this group, the occupational environment really is what leads to the return of childhood or adult onset asthma. So as you can see, the majority of these people have had some form of asthma before. Next, we can, now talk about the much dreaded, difficult to control or severe asthma group. The good news here is that roughly, only about 10% of those with asthma, belong to this category. The key to treatment in this group is tight control. Having an action plan that includes the appropriate medication and compliance and an avoidance of known triggers to asthma is usually the key in this difficult to treat asthma group. Next is seasonal asthma. This form of asthma is often associated with environmental surroundings at certain times of the year. It is commonly a reaction to cold air in the winter or pollen during hay fever season. Now that we have touched on the different types of asthma, let's discuss the different causes of this disease, and believe me, there are many of them. At the top of the list, again, is allergies. Over the years, studies have shown that there is a very strong and direct correlation between allergies and asthma. As a matter of fact, some studies suggest that over half of the adults with asthma over the age of 55 have a component of some form of allergy. This could be an allergy to common sources of indoor allergens, such as animal proteins, mostly, from cat and dog dander, dust mites, cockroaches, and even fungi. Next is tobacco smoke. It is indisputable that there is a strong link between tobacco smoke and increased risk of asthma, wheezing, lung infection, and death from asthma. As a matter of fact, research has also shown that children of parents who smoke have a much higher risk of developing asthma. The thing to remember about tobacco and asthma is that it worsens the symptoms and effects of asthma on the airway by inducing cough and shortness of breath, as well as increasing the risk of infections from overproduction of mucus. Now let's move on to environmental factors. Air pollution, both in and out of the home, can impact the development of triggers of asthma. A study conducted by the World Health Organization a few years ago estimated that about half of the asthma burden worldwide is due to our environment. And in the United States, it is estimated that roughly a third of asthma exacerbations among children can be related to the environment. So this is a big deal. Some of us, are too familiar with the adverse effects of cold temperature, high humidity, and indoor air pollution from mold or noxious fumes from, say, household cleaners and paints on asthma attacks. However, though, what we rarely discuss are some of the day-to-day environmental triggers that contribute to, say, the ozone and even acid rain, and the role they play in pulmonary disease. I know some of you, may wonder how this could, possibly lead to an asthma attack. Well, people that live in parts of the industrial world where air pollution caused by exhaust emissions or chemical mixing, that create what we, know as smog, would better understand the impact it has on health and airway disease. It is a known fact, though, that smoggy conditions, release the destructive airway irritants known as ozone, which, causing intractable cough and shortness of breath and occasionally chest discomfort and chest pain. However, how about, changes in the weather? Anyone that has ever been in a cold environment knows that cold air can lead, to airway, congestion, constricted airway, and mucus secretion. And I also know that some of you may also be wondering, especially if you live in humid parts of the world and still have asthma or asthma attacks. Well, this is the deal with humidity and asthma. Breathing in humid air activates nerves in our lungs that narrow and tighten our bronchioles or airway. So that said, humidity also makes air stagnant enough to trap the pollutants and allergens we've already mentioned, like pollen, dust, mold, dust mites, and smoke. The real question here is, how do we prevent this? And, the answer is not to sell your home and move to a different, climate. We can start with simple things like, utilizing a humidifier, making sure that we have, clean air filters at home. And if you have a member of, if you're a member of the State Tobacco Club, it might be time to consider, giving it up. Let's move on to pregnancy and asthma. The only thing that I can really say to this is that it is a known fact that women that smoke or use illicit drugs while pregnant often run the risk of experiencing an unborn child with growth retardation, labor and delivery complication, and low birth, delivery weight. And the newborn are usually more prone to medical problems, including reactive airway diseases such as asthma. Next is stress. We all have stress. I want to meet someone who does not have a stressful life. I don't know if there's anyone out there that can say they don't. The key here is that those with undue amount of stress are more prone to indulge in behavior that are known triggers to asthma, such as smoking. On the other hand, heightened emotional responses such as laughter and grief also triggers of asthma attacks. How about, genetics and asthma? To better understand the role of asthma and heredity is to understand that asthma is a polygenic multifactorial disorder, meaning that many factors contribute to its development. And these factors are both genetic and environmental. This discussion would not be complete if we did not discuss atopy and asthma. Atopy refers to the genetic tendency to develop allergic diseases such as allergic rhinitis, asthma, and atopic dermatitis, or otherwise known as eczema. It represents the most common form of asthma in the pediatric age and is typically associated with a heightened immune response to common allergens, such as the ones we've already discussed. So many questions regarding the menstrual cycle and asthma. All I can really say is that research has shown that after age 15, asthma is more common in girls and women than in boys and men. This is believed to be partly due to the fact that women with asthma may have more symptoms during certain times around the menstrual cycle. And it is also believed that the decrease in progesterone and estrogen levels just before and during the menstrual cycle may contribute to worsening asthma in young women. So, what is the takeaway message for managing and preventing asthma? These are my recommendations. 1, get regular checkups. Set healthy goals for yourself. Have a written asthma action plan with you at all times. Avoid triggers such as tobacco smoke, dust, perfumes, or even furry animals. Medication compliance. Take your medication as prescribed. And have a conversation with your doctor about getting the flu shot annually. Exercise, and do it regularly. I hope this discussion has been helpful to someone out there. That is all I have to share with you about what we need to know about asthma and its prevention. Feel free, to leave comments on any topics you would like us to discuss in the future. And also feel free to subscribe to Urgent Care on Call for future clinical discussions by pressing the subscribe button below. Remember though, for all your non-emergent healthcare needs, we can be reached at our telemedicine platform at www.urgentcareoncall.com. Thank you.